Hi friends, hello, welcome to my channel The Voice of Nurse. Good morning friends. Today we are going to discuss Telangana State Staff Nurse 2023 questions and answers in previous years FAQ, frequently asked questions. This is part 3 friends. In previous videos I already explained part 1 and part 2 from the question 1 to question 70. The continuous video, this is part 3. Not only in previous part 1, part 2, I already explained these many videos NHM 2022, 2023, nutrition and anatomy of point of view and heart, cardiovascular system related questions and answers. Please friends, you can check it once. Before moving on to topic, I very thankful to my subscribers. Successfully I got a first hit of 100 subscribers. Thank you so much friends. Please support me like this friends. మీ సపోర్ట్ నాకు బూస్ట్ని ఇస్తుంది. సో సపోర్ట్ మీ అండ్ బ్లెస్ మీ. ఎవరైతే నా ఛానల్ని ఫస్ట్ టైం చూస్తున్నారో ప్లీజ్ ఫ్రెండ్స్ సబ్స్క్రైబ్ మై ఛానల్, క్లిక్ ఆన్ ది బెల్ ఐకాన్ ఫర్ ఫర్దర్ నోటిఫికేషన్స్. లెట్స్ మూవ్ ఆన్ టు టాపిక్. సో ఐఎమ్ హ్యావింగ్ ఏ స్మాల్ రిక్వెస్ట్ ఫ్రెండ్స్. ఎవరైతే వీడియోస్ వాచ్ చేస్తున్నారో ప్లీజ్ ఫ్రెండ్స్ గివ్ ఏ లైక్. మీరు లైక్ చేస్తే నాకు ఏంటి వీడియోస్ మీకు యూజ్ అవుతుందో యూజ్ అవ్వట్లేదా అనేది నాకు కొంచెం తెలుస్తుంది. ఇంకా నేను వెరైటీ వీడియోస్, ఇంపార్టెంట్ క్వశ్చన్స్, డిఫరెంట్ సబ్జెక్ట్స్ని తీసుకురావడానికి వీడియో చేయడానికి చాలా ట్రై చేస్తాను. థ్యాంక్ యూ ఫ్రెండ్స్. This video we will discuss from the question number 70 to 100. The 71 question, length of male urethra is approximately how much? Okay friends, we will see the options here. Option A 30 to 40 centimeters. Option B 18 to 20 centimeters. Option C 10 to 12 centimeters. And option D 2 to 4 centimeters. The length of male urethra measures an average 18 to 20 centimeters in length and it extends from the neck of the bladder to the external meters of the glans penis. So here 18 to 20 centimeters is the correct answer, option B. Okay friends, length of male urethra is approximately 18 to 20 centimeters. Next move on to question number 72. Bone forming cell are known as. Okay friends, bone formation of the cell is called as. We will see the options here. Option A osteocytes, option B osteoclasts, option C osteoblast and none of the above, option D. Here what is osteocytes, what is osteoclasts, what is osteoblast, we have to know. Before question move on to question, we will discuss regarding options here. Osteocytes. Osteocytes means a cell that lies within the substances of fully formed bone. This is not called as bone forming cell. Next, move on to question option B, osteoclast. Osteoclasts means osteoclasts occupy small depressions on the bone's surface. So this is not correct answer. Option C, osteoblast. Osteoblast means the osteoblast cells that form a bone tissue. So here option C is the correct answer. Osteoblast. Bone forming cell are known as osteoblast. We can see here the first one is osteoclast and second one is osteoblast. See here second circle is the option C, osteoblast. The cell formation is there here in this second picture. Here option C is the correct answer. We will move on to question number 73. If a patient receiving IV fluid develops tenderness, warmth and erythma at the site of IV canula, nurse should suspect. Here in this question, patient is receiving IV fluids, that patient is complaining of or developing tenderness, warmth and erythma at the site of IV cannula. Nurse should suspect from the following options. Option A thrombosis, option B infiltration and option C phlebitis and option D sepsis. Here no doubt friends, phlebitis is the correct answer, option C. But we will discuss here what is thrombosis. Thrombosis means the thrombosis occurs when blood clots are black in the veins and arteries. Most commonly we can see the in heart. We can see in heart. Thrombosis we can see the cardiac diseases. Next, option B, infiltration. Infiltration is defined as the flow of water from above ground into the subsurfaces. So this is not correct. The phlebitis. Phlebitis means may occur with or without blood clot. We can see here phlebitis. IV cannula site phlebitis, redness and warmth and erythma. These signs of symptoms we can see in the phlebitis. It can affect surface or deep veins. In case caused by blood clot is called as thrombophlebitis. Okay friends, we can treat the phlebitis cases with cream or gel can use it if the affected area is small, or cold application also we can do it. Okay friends, this is phlebitis. What is sepsis? Option D. Sepsis is a life-threatening complication from the infections. Sepsis is life-threatening complication of an infection. So here the patient is having tenderness, warmth, erythma, redness from the eye at the site of IV cannula means phlebitis. We can see here in this picture phlebitis, redness at the IV cannula. Move on to question number 74. Bile. This is 74 question, not 73. Bile is helpful in options. Option A, emulsification of fat. Option B, digestion of fat. Option C, digestion of protein. And option D, emulsification of glucose. Here bile salts help in the emulsification of fat. Emulsification of fat. Option A is the correct answer. For example, break down the large fat droplets in very small micelles. So here bile is helpful for the emulsification of fat. Option A is the correct answer. Next we will see the question number 75. Blood groups were first described by options. Option A, Carl Landsteiner. Option B, Robert Koch. Option C, A.V. Leeuwenhoek. And option D, Paul Ehrlich. Here option A is the correct answer. Carl Landsteiner. Blood groups first discovered by Austrian scientist Carl Landsteiner, who identified the O blood group A and blood group B. These are the blood types in year of 1900, means 1900 in the year of 1900. The Carl Landsteiner was first discovered blood groups. Here option A is the correct answer. Next we will move on to question number 76. Total amount of blood in human body is option A 4 to 5% of body weight. Option B 7 to 8% of body weight. Option C 20 to 22% of body weight. Option D 12 to 13% of body weight. Okay friends, the amount of blood circulating within individual depends on their size and weight of themselves. Average amount of blood in human body around 10 pints or 8%. In liters we can calculate like nearly 5 liters in adult. So here 10 pints or 8% is the correct answer. So option B 7 to 8% of body weight. The total amount of blood in human body is 7 to 8%. So here option B is the correct answer. Here we can see the how much blood is in the human body. The volume of blood in the average healthy adults is about 5 liters. Neonates we can see here 85 to 90 ml per kg. Infants 75 to 80 ml per kg. Children 70 to 75 ml per kg. And adults 85 to 70 ml per kg. Here we can see option B is the correct answer, 7 to 8% in body weight. Next, move on to question number 77. At the tip of penis, triangular structure is known as. Okay friends, at the tip of penis, the triangular structure is called as options. Option A, glans penis. Option B, prepuce. option C, sperm, and option D, urethra. In male human anatomy, the glans penis, commonly referred as the glans, is the bulbous structure at the distal end of the human penis in males. The end of the human penis, the portion, the distal end is called as glans penis. Option A is the correct answer. Tip of penis triangular structure is also called as glans penis. Option A. Next, we will move on to question number 78. Enzyme, heparin and histamine are secreted by options. Option A, fat cells. Option B, mast cells. Option C, leukocytes. And option D, RBCs. Here, the enzyme heparin and histamine is secreted by the mast cells. The mast cells is a type of granular basophil cells in the connective tissue that releases heparin and histamine and also serotonin during inflammation and allergic reaction. So, the enzyme heparin histamine secreted by the mast cells. Option B is the correct answer here. Next, move on to question number 79. Total period of one cardiac cycle is. Okay friends, what is the total period of cardiac cycle? Not total cardiac cycle, one cardiac cycle here. Options. Option A 2 seconds, option B 5 seconds, option C 0.8 seconds and option D 1 second. Here the cardiac cycle involves a complete contraction and relaxation of both the atria and ventricles. Atrium and ventricles. The cycle lasts approximately 0.8 seconds. Here option C is the correct answer. Cardiac cycle involves the complete contraction and relaxation of the both atria and ventricles. Here option C 0.8 seconds is the cardiac cycle, one cardiac cycle period here. Option C is the correct answer. Next, move on to question number 80. 18th question 80. Which is the largest vein in the human body? Okay friends, not in cardiac system, not in central nervous system. Here, which of the largest vein in the total body of humans? Options. Option A, superior vena cava. Option B, femoral vein. Option C, cerebral vein. And option D, inferior vena cava. Here, the inferior vena cava. Okay friends, inferior vena cava, option D is the correct answer. The inferior vena cava carries blood from the legs, feet and organs in the abdomen and pelvis. The vena cava is the largest vein in the human body. Here option D is the correct answer. We can see here in this picture the inferior vena cava. Heart. We can see inferior vena cava in heart, the bottom of position. Green color circled line is there. This is the part of inferior vena cava in the heart. Inferior vena cava is the largest vein in the human body. So here option D is the correct answer. Next, we will move on to question number 81. Which is the most common cation of ECF? ECF means extracellular fluid friends. Here, which is the most common cation of extracellular fluid? We will see the options here. Option A, sodium. Option B, calcium. And option C, potassium. And option D, all of the above here. The most abundant cation in the extracellular fluid is option A, sodium. Option A here, correct answer, sodium. The most abundant anion of extracellular fluid is chloride. Okay friends, don't confuse here friends. Here clearly I am explaining the cation in the extracellular fluid is sodium. The anion in extracellular fluid is chloride. Okay friends, option A is the correct answer here. The most common cation of extracellular fluid is option A, sodium. It is related to extracellular fluid. In case the intracellular fluid means in case of abundant cation in the intracellular fluid is potassium friends, not sodium. In the intracellular fluid cation is potassium, extracellular fluid cation is sodium. Here in this question Extracellular fluid means sodium is the correct answer, option A. Next we will move on to question number 82. Which among the following is not considered as principle of surgical asepsis? Here clearly mentioned not consider as. Okay friends, not consider as principles of surgical asepsis. We will see the options here. Option A, the edges of sterile field is considered as sterile. Option B, only sterile object is placed on a sterile field. Option C, sterile object out of range of vision is contaminated. And option D, only dry is considered as sterile. Here the question not considered as principles of surgical asepsis means the edges of sterile field is considered as sterile, means this is not a principle of surgical asepsis. So here option A is the correct answer. Surgical asepsis is the absence of all microorganisms within any type of the invasive procedures. So option A is the not principle of surgical asepsis. Okay friends, next we will move on to question number 83. In an adult, weight of kidney about approximately, what is the weight of the kidney in adult? Option A 400 grams, option B 250 grams, option C 140 grams, and option D 50 grams. Here each kidney is approximately 3 centimeters thickness, 6 centimeters wide and 12 centimeters long. In males and females it is different size of kidney we are having friends. Here in adult, okay friends, not in male and female, no differentiation in this question. There is no differentiation of question here asked about adult weight of kidney. Option C is the correct answer, 150 grams. But we will discuss in males and females because we have to know what is the weight of kidney in males and females. Here in males the average weight of the kidneys is approximately 129 grams for the right one and 137 grams for the left one. Okay, the right kidney is 129 grams, the left kidney is 137 grams in males. In the females, average weight of the kidney is 108 grams for the right kidney and 116 grams for the left kidney. So left kidney is little bit bigger than right kidney. So here in adult the weight of kidney is option is the correct answer, 140 grams. Next move on to question number 84. 3 types of fibres present in which tissues? Okay friends, here 3 fibers are present in the one of the tissue following. What is that? Options. Option A areolar tissue, option B reticular tissues, and option C adipose tissue, and option D ligaments. Here areolar tissue is the most common type of connective tissue. Option A is the correct answer. In areolar tissue 3 types of fibers are present. Those are collagen, reticular and elastic fibers from the mesh structure of the connective tissue. For example, between the skin and muscles, in the bone marrow also we can see the areolar tissue. Here the 3 types of fibers present in the tissue is areolar tissue. Option A is the correct answer. In this picture we can see the areolar tissues. Okay friend, areolar tissue is present with 3 types of fibers. Those are collagen in the downwards and also reticular tissue and also elastic fibers. So here areolar tissue is the correct answer. Next we will move on to question number 85. The nervous system coordinating different activities of intestinal organs is options. Option A central nervous system, option B peripheral nervous system, and option C autonomous nervous system, and option D none of the above. Here in this question, what is the coordinating different activities to the nervous system through the nervous system to the intestinal organs? Here, option C is the correct answer. Autonomous nervous system that regulates involuntary physiological process including the heart and blood pressure, means heart rate and blood pressure and respiration and digestion, and also the sexual arousal. Here, autonomous nervous system is coordinating the different activities in the intestinal organs. Option C is the correct answer. Here we can see the autonomous nervous system, the parasympathetic division. It is different activities like pupils constriction, salivation, airway constrict and heart rate, and also stomach digestion, intestinal digestion, bladder constriction, and reproductive system increases blood flow. Here, option C is the correct answer, autonomous nervous system. Move on to question number 86. Peptic ulcer is caused due to. Okay friends, what is the cause of peptic ulcer from the following options? Option A, alcohol. Option B, non-steroid anti-inflammatory drugs. Option C, smoking, and option D, all of the above. Here, most common cause of peptic ulcer is infection with the bacterium. What is that bacteria? Is H. pylori bacteria. The common cause of the peptic ulcer is peptic ulcer infection due to the bacterium H. pylori bacterium. The long-term use of non-steroidal anti-inflammatory drugs and stress and spicy foods, the modified factors also. Here options, all of the above is the correct answer. Tobacco smoking, stress and alcohol intake also one of the causes for the peptic ulcer. Alcohol, NSAID, smoking, these all are the causes of the peptic ulcer. Option D is the correct answer. Here we can see the peptic ulcer disease, the ulcer formation in the stomach. Causes are NSAIDs, H. pylori, alcohol and smoking, and also related to stress, related to the some of the conditions also. Here option D is the correct answer. All of the above, peptic ulcer caused by the all of the above options. Next we will move on to question number 87. Following is the chromosomal abnormalities in children. Okay friends, from the following options, one is the chromosomal abnormality. Options, option A, TOF, tetralogy of Fallot. Option B, ASD, atrial septal defect. Option C, Down syndrome. Option D, atriosis. Here the tetralogy of Fallot and atrial septal defect and also atriosis is related to the congenital heart diseases related to the heart. Here chromosomal abnormalities is option C, Down syndrome is the correct answer. This is also called as Down syndrome, also called as trisomy 21. It is one of the genetical disorder and chromosomal disorder. In trisomy 21, what will happen? In trisomy 21, in which a person has a extra chromosome due to the abnormal cell division. Down syndrome is a genetic condition that causes mild and serious physiological and developmental problems that children is having. Here we can see the picture. The physiological means physical features of the children. The short legs and short neck and flat face. These all are the short fingers. These all are the features in the Down syndrome children. So the chromosomal abnormalities in children following the options is option C, Down syndrome is the correct answer. On to question number 88. Eye sockets present in, means the eye socket is present in the following options from the bone, means from the facial bones. Options, option A, ethmoid bone. Option B, occipital bone. Option C, frontal bone, and option D, parietal bone. Here eye socket is present in frontal bone of the skull. Here option C is the correct answer. In the anatomy point of view, the orbit is the cavity or socket of the skull in the which the eye and its appendages is situated in the frontal bone. So eye socket is present in the frontal bone. Option C is the correct answer. Here move on to question number 89. Human vertebral formula is, okay friends, from the human body the vertebral formula. options. Option A C7, T12, L4, S5 and C3. Option B C4, T7, L5, S3 and C2. Option C C7, T4, L3, S4 and C3. Option D C7, T12, L5 and S5 and C4. Here human vertebral formula means we have to know what is C, T, L, S and C. The options from the options. The option D is the correct answer. C7, T12, L5, S5 and C4. What is C? C means cervical. Okay friends, cervical vertebra. Cervical vertebrae we are having 7. Next, what is T? T means thoracic vertebrae. Thoracic vertebrae we are having 12 vertebrae. Next, what is L? L means lumbar vertebra. We are having 5 lumbar vertebrae. Next, S means sacrum vertebra. 5 we are having. Next, C4 means coccyx. We are having 4. The articulating vertebrae are named consisted with the region of the spine. There are 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae and 5 sacrum vertebrae and 4 coccyx. Here option D is the correct answer. Here we can see in this picture the cervical, thoracic, lumbar and sacrum vertebrae and coccyx also. It is identify with, we can identify the vertebral names with the C, T, L, S and C. Here option D is the correct answer. Next we move on to question number 90. GnRH. GnRH is secreted from. What is GnRH? GnRH means gonadotropin releasing hormone. Okay friends, gonadotropin releasing hormone. Here GnRH is secreted from the options. Option A anterior pituitary, option B pituitary, post pituitary gland and option C ovary and option D hypothalamus. Here hormone made by a part of the brain is called as hypothalamus. GnRH, gonadotropin releasing hormone, causes the pituitary gland in the brain to make secrete the LH and FSH. Here option D is the correct answer. GnRH secreted by the hypothalamus. We can see here in this picture from the GnRH from the neurons. This is GnRH to the pituitary glands. It is secreted the LH and FSH. It transferred to the ovary. Here the GnRH, gonadotropin releasing hormone is secreted from the hypothalamus. Next we will discuss question number 91. Move on to question number 91. Question number 91. Total salt content in blood plasma. What is the content? Total content of salt in blood plasma. Options. Option A 0.6 to 0.8%. Option B 0.85 to 0.90%. Option C 0.9 to 0.95%. Option D 0.4 to 0.6%. The normal range of blood sodium levels is 135 to 145 milliequivalent per liter. The normal range of or normal percentage of salt in our blood account is 9 grams per liter or 9% according to the weight of the person. Here option B is the correct answer. The total salt content in blood plasma is 0.8% to 0.90 is the correct answer. Let's move on to question number 92. One of the following is absent in the heart. Okay friends, from the following option, one is the absent option in the heart. Option A bicuspid valves, option B tricuspid valves and option C sinus veneris and option D pulmonary vein. Okay friends, here in the human heart, from the following options, one is the absent, means during the human heart development the sinus venosus become incorporated into the right atrium. So here option C is the correct answer. Sinus venosus is absent in the heart. Sinus venous is having one of the congenital heart disease. This is called as sinus venous atrial septal defect. It is one of the rare congenital heart disease. Okay friends, here we can see the superior sinus venous atrial septal defect. Here we can see in the middle of the heart, in between the right atrium left atrium, the defect is there here. That is called as sinus venous atrial septal defect. Next, we will move on to question number 93. 93 question is, according to the National Pressure Ulcer, a wound with exposed subcutaneous tissue belongs to. Means the pressure ulcer, a wound with exposure of subcutaneous tissue, is belongs to which stage? Option A stage 1, option B stage 4, option C stage 3 and option D stage 2. Here the wound with exposed tissue is called as stage 3. Option C is the correct answer. What is stage 1? We'll see here. Ulcer with mucus coating edema is present means redness is called the stage 1, means in this pressure ulcer the redness is happened in the first stage. So here option A first stage is redness and also some of the erythma. Next option B stage 4 means skin peeling that pressure ulcer is having. Next option C stage 3 is wound exposed subcutaneous tissue. In stage 4 means option D stage 2 means mucus coated ulcer with the margin edema is present in the pressure ulcer. Here the adversive panel, a wound exposed with the subcutaneous tissue, is option C stage 3. Next move on to question number 94, which is refers to two structures which are on the opposite side of the body midline. Okay friends, which is the refers to from the following two structures which are the opposite side is called as from the body of midline. Options: option A ipsilateral, option B contralateral, option C anterior and option D posterior. Here option B is the correct answer. The two structures which are one opposite side is called as from the body of midline is contralateral. Option B is the correct answer. What is ipsilateral? Ipsilateral means one same side, means same side of the body. This is opposite side to the means opposite to the contralateral. Ipsilateral means on the same side. For example, tumor is involving the right side of the brain means it may affect the vision of the right eye only, not at all affect the left eye. This is same side will be happen. Next, what is contralateral? Contralateral means opposite side of the body. For example, one patient is complaining stroke, means stroke involving the right side of the brain may cause the contralateral paralysis of the left leg, means from the they are having complaint of stroke in the right side, but here left leg also will be paralyzed to the left leg. So here contralateral means opposite side of the body. Here option B is the correct answer. We know what is anterior, what is posterior. No need of explanation for these options. Next move on to question number 95. Anterior fontanella is also called as option A bregma, option B vertex, option C lambda and option D glabella. This is one of the easy question, but I will explain bregma, vertex, lambda and glabella in these options. Okay friends, bregma is the correct answer. Anterior fontanella is also called as bregma. The anterior or bregmatic and the posterior lambdoid fontanelles are present. Okay friends, anterior portion is present is bregma and posterior present is lambdoid fontanelles. Here what is vertex? Vertex means highest point of the head is vertex. Two parietal bones, one frontal bone and also occipital bone is in the vertex. What is lambda? Lambda is present at the occipital bone. Next, what is glabella? Glabella is a present at the orbital region in the frontal bone. We can see the skull. What is bregma? Bregma is anterior point of the parietal bone is bregma. What is lambda? Here we can see the portion of the occipital bone. It is called as lambda. Okay friends, we can see the total fetal skull. Front of the orbital region is called as glabella. This chin is called as mentum. Back side of the occiput portion is called as lambda, and also highest point of the head is called as vertex. This is having two parietal bone, one frontal bone, and also occipital bone. The anterior fontanelle in this question, anterior fontanelle is called as bregma. Option A is the correct answer. Next, move on to question number 96. End of two bones is connected by. Okay friends, two bones is connected by from the following options. Option A ligament, option B tendon, option C muscles, and option D cartilage. Here end of two bones is connected means option A is the correct answer, ligament. Okay friends, option A is the correct answer, but we will discuss from the options tendon, muscles, cartilage and ligament what is the joint. Okay friends, the point at which two or more bones is connected is called as joint. Okay friends, joint means point at which two or more bones is connected is called as joint. In all joints, the bones are kept from grinding against each other. Lining is called as cartilage. What is cartilage? Cartilage means bones are kept from the grinding against each other by lining is called as cartilage. Okay friends, what is ligament? Ligament means bones are joined to bones by strong elastic bands of tissues is called as ligament. Here, what is tendon? Muscles are connected to bones by tough cords of tissue is called as tendons. Here end of two bones is connected by the ligament. Option A is the correct answer. Next, move on to question number 97. Seventh question is, what is the function of phospholipids in the plasma membranes? We will see the options here. Option A, to maintain ICF at similar composition of intestinal fluid. ICF means intracellular fluid friends. Okay friends, intracellular fluid. Next, option B, to form channels to selectivity allow passage of small molecules. Next, option C, to present a barrier to the passage of HO2 water soluble molecules. Next, option D, all of the above. These all are the functions of phospholipids or plasma membranes. Here the functions of plasma membrane is to present a barrier to passage of water soluble molecules. Molecules that are more soluble in water cannot pass through the lipids or fat. So phospholipids are a barriers here. So here option C is the correct answer. The function of phospholipids of plasma membrane is option C. Next, move on to question number 98. The 98th question. A client with Pyrexia will most likely demonstrate. If patient is having pyrexia, from the following option, what is the symptom they are having? Option A, elevated blood pressure. Option B, increased pulse rate. Option C, dyspnea, and option D, all of the above. Here, if one patient is having fever means they are having high pulse rate here. This is also one of the easy question, but here I will explain in detail. Fever may not cause difficulty breathing and blood pressure is not necessarily elevated in the fever cases. The pulse rate is increases to meet increased tissue demand for the oxygen in febrile state, means fever stages. Here, in case of patient is having fever, pyrexia, fever means the pulse rate will be increased. Option B is the correct answer. Next, move on to question number 99. Cerebellum. Cerebellum is considered with options. Option A, vision. Option B, memory. Option C, coordination of muscular movement. Option D, perception. Here, cerebrum. Cerebrum is a Latin word, means cerebellum word is a Latin word which means little brain. Cerebellum is also called as little brain. Cerebellum is considered with coordination of muscular movement. Option C is the correct answer. Cerebellum is a part of your brain located at the back of your head, just above the behind, where your spinal cord connects to the brain itself. So, cerebellum main job was to coordinate your muscles and muscle movements. So, option C is the correct answer here. This picture we can see the cerebellum part in the brain. It is connected to the brain at the behind of spinal cord. We can see here the circled green circle line, the cerebellum. The top of the brain is cerebrum, not cerebellum. The downwards, the green color circle line is the cerebellum. Cerebellum considered as coordination of muscular movements. Here option C is the correct answer. Next, move on to question number 100. The total volume of CSF fluid secreted in 24 hours. Options. CSF means cerebrospinal fluid here. Option A 500 ml. Option B 1000 ml. Option C 1200 ml. Option D 800 ml. Cerebrospinal fluid is a clear colorless body fluid found with the tissue that surrounds brain, spinal cord of the vertebrae. Okay friends, here option A cerebrospinal fluid secreted in 24 hours 500 ml is the correct answer. The total volume of cerebrospinal fluid is 150 ml for the average adult, where 125 ml is confined to the subarachnoid spaces. It is 25 ml in the ventricles. The total volume of cerebrospinal fluid produced roughly 580 ml per day. Not exactly 500 ml, roughly is 580 ml per day. Here the total volume of spinal fluid, cerebrospinal fluid in 24 hours, option A 500 ml is the correct answer. We can see here the blue portion of the picture is cerebrospinal fluid. It is surrounds to the brain and spinal cord and also all of the vertebrae. Here option A is the correct answer. 500 ml cerebrospinal fluid secreted in the 24 hours. 500 ml is secreted. So here option A. Next, this is the last question in the part 3. From the first question to 100 questions we discussed regarding anatomy and physiology point of view. Next video we will discuss the gynecological nursing point of view. 100 questions we will discuss. Once again, I am very thankful to all my subscribers for the 100 subscriptions. Thank you so much. Please support me like this and give a like and share the video. And thank you so much friends. Thank you for watching my video. Stay tuned friends. We will meet in next video. ఎవరైతే నా ఛానల్ ఫస్ట్ టైం చూస్తున్నారో ప్లీజ్ సబ్స్క్రైబ్ చేసుకోండి. క్లిక్ ఆన్ ది బెల్ ఐకాన్ ఫర్ ఫర్దర్ నోటిఫికేషన్.